Welcome to another episode of How to Live to 200. I'm T.A. McCann, your host, and thanks again for joining us for conversations about science, technology, human performance, and longevity. As a reminder, we just launched a few new shows that include topics like hyperbaric oxygen and mercury toxicity, The Tim Gray Show, methylation, epigenetics, and men's sexual health, The Miles Spar Show. Grab these and subscribe at livingto200.com. I hope you check them out and share them with your friends. We're also planning a bunch of new shows with the likes of Liz Parrish, talking about gene therapy and medical tourism, Aubrey de Grey, some would say the father of longevity research, and Sonia Arison, giving us an investor's perspective on longevity, including the topic of parabiosis, using other people's blood to live longer. I know there's some crazy stuff out there to explore. So subscribe and send us your questions and ideas. We want to discover more things with you. Today on the show, we have Ramez Naam, or his friends like to call him Mez. Mez spent 13 years at Microsoft, where he led teams developing early versions of Microsoft Outlook, Internet Explorer, and the Bing search engine. Between stints at Microsoft, Mez founded and ran Apex Nanotechnologies, the world's first company devoted entirely to software tools to accelerate molecular design. He holds 19 patents in the areas of search engines, information retrieval, web browsing, artificial intelligence, and machine learning. He also lectures at Singularity University, which I'm a big fan of. I suggest you get their newsletter, especially the one on health from Daniel Kraft and his team. So you might be asking yourself, why Mez? Well, he wrote this very cool book called More Than Human, Embracing the Promise of Biological Enhancement, which I highly recommend. That book talks about the emerging science and experiments in the area of health and longevity. But he's even more well known for his science fiction books called Nexus, Crux, and Apex, about brain-computer connections and communication. So you see where this is going? If our brains are connected with each other or connected to the internet, and we can upload our consciousness or move things to other people, maybe we can actually live forever. Get it? Like many shows, we have a wide-ranging conversation, but a few topics stood out for me. Where Mez gets his ideas for the future, and how he translates those into nonfiction, fiction, and his many presentations. Digital health, especially in the developing world, and in some ways how they may be ahead of us, with a focus on AI, big data, and mobile phones. You know I like this area given my cynosis background. Gene editing, and how rats are already living in the lab to the human equivalent of over 200. So there is promise there. And last, his 3-minute exercise. I know that sounds like clickbait, but it's really good discussion. I had a lot of fun with this interview, and I hope you'll enjoy our conversation with the infamous Ramez Naam. And now, this is How to Live to 200. So, hey, Mez, welcome to the show.
Hey, TA, good to be here.
It's so nice to connect with you. I've enjoyed reading at least 3/4 of one of your books.
Awesome.
And I'm very interested in what was your journey from sort of technical to writing, and how did you end up writing about the things you do?
Yes, I'm a software guy. I've got a degree in CS, worked at Microsoft, and I used to read scientific journals for fun. They were like the back of toilet reading, if you will, Science and Nature. And I was also a big science fiction geek my entire life. And I started to see this stuff around 99 or 2000 of actual science, usually in rats and so on, that sounded like science fiction, like animals with robot arms attached to their brains, animals where the aging process had been slowed. And frankly, I quit Microsoft, started a startup. The startup flopped, and I didn't know what to do. So I wrote a book about the technology and science of actually augmenting performance and slowing down aging and things like that, what was happening in animals and how it might one day apply to humans.
And this is the book?
That was More Than Human, my first book, yeah.
And then what led you from, and I want to come back to More Than Human because I found it fascinating, what led you to wanting to write more fiction versus nonfiction, which More Than Human is a nonfiction book?
Yeah, More Than Human's nonfiction. I've read science fiction all of my life. It was actually the majority of what I read. And then I quit Microsoft a second time in about 2010-ish. And the excuse I gave was I'm going to write more books. And then my nonfiction agent didn't like my next nonfiction book idea. So I love my nonfiction agent. My attitude was like, screw you, I'm going to write a novel then. So I decided to take basically the concepts of More Than Human. What if we had technology to give people sort of superhuman abilities? And then what are the ethics, the morality, what are the conflicts between those who want it and don't want it, and turn that into a near future sci-fi thriller. And it was great fun.
Well, it's my next book. I'm leaving on vacation next week, and it was one that I'm taking with me. So awesome. I'm excited about that.
Awesome. Yeah, that one's Nexus, and that was a lot of fun.
That's right. How do you go about researching the categories of stuff, especially in this sense of nonfiction and health or human performance, longevity? What is your process of researching to find what's going on?
Yeah. I mean, things have changed. So my process now is data comes to me a lot of times. Like, you're on social media. If you're following the right people, you see what they post and so on and so forth. And now I've written enough about these topics that people reach out to me when they see something interesting. But certainly back in the day, even then in the late 90s, early 2000s, Wikipedia existed. You could start wherever you wanted, and you could go down the rabbit hole of going from Wikipedia to reading deeper and deeper lay articles people had written, pop science articles, deep blog posts, to searching in PubMed and reading abstracts of articles, buying journal access, or searching for free copies of PDFs of articles from $1,000 journals, and then occasionally paying for something. And then when I realized I was writing a book, frankly, I started emailing professors and academics and saying, hey, I read, these 3 papers, and I'm writing a book and I have some questions for you. And people are pretty excited to talk about their work. So
it's amazing when you have a vehicle that people respond to your emails in ways that they normally wouldn't.
Yeah, saying
like having you on this podcast, which has been great. Thank you.
Absolutely. Yeah, my pleasure. Good to be here.
And when you were thinking about Nexus or others, like what was the kernel that said that's the research that I was really interested in, that I wanted to build the story around?
So the funnest thing I wrote about in More Than Human was this technology that was implants in the brain, neural prosthetics, brain-computer interfaces. And back in 2000, we had this study that had a rat with a set of electrodes in its brain that gave it control over a robot arm. And it could use the robot arm to feed itself, or feed itself water anyway. And I just thought, that's trippy. I mean, The Matrix had come out, and I thought The Matrix was incredibly far-fetched, hundreds of years away. And then I'm like, this is happening now. So that's what I built Nexus around. And I'm a burner. I go to Burning Man. I grew up in the rave scene in Seattle. Not exactly grew up, but in my 20s. So I wrote it as there's a technology that goes into your brain that's also an illegal drug, and it's being done by grad students in San Francisco who are part of the party scene, just to like throw in as much as I could to make it a little bit over the top and pretty fun.
And so what are the things that you're finding now, given that you have those relationships with professors, you have the notoriety as an author? What stuff is coming inbound for you? What's being alerted to you? And what things are you sort of looking for outbound?
Yeah, so across the gamut, I mean, I wrote about a bunch of technologies in More Than Human in particular. I wrote about gene editing technologies, gene therapy, smart drugs, technologies to slow the aging process, and these brain-computer interfaces. So across the gamut, I'd say there's a whole lot is happening. It's happening, frankly, slower than I hoped and expected when I wrote my first book. But certainly CRISPR and what's happening there, even more important than CRISPR, I think, is new gene delivery technologies that are more effective at getting genes into living human bodies. And then it's a golden age in brain-computer interfaces with Elon Musk doing stuff with Neuralink, my friend Brian Johnson, who founded Braintree, doing stuff with his company Kernel, Facebook doing stuff, Mary Lou Jepsen with her own company, Thomas Reardon, who's a Microsoft alum, who's got his own company. And so we've got sort of a lot more happening on the using technology to interface with and augment human brains than at any point in history today.
Maybe you can go back to More Than Human and explain a little bit of the gene therapy and the delivery mechanism, because I found that particularly fascinating. Like, how does a scientist or a clinician actually go about delivering some of this into the body?
Yeah, so we have...
Or give maybe an example of how that happens, both when you wrote or today.
Sure. So we have, genes are the code of life, if you will. They're the code that, tells the machinery of the cell what proteins to make throughout the cell, and that really dictates everything. It is spaghetti code, let's be clear. It's nothing like anything that you would write yourself, and it's hard to untangle. So we have technologies that are good at editing genes in a cell in a petri dish, for instance, and that's really what CRISPR is. And so with that, if you want to do, better plants, for instance, or engineer E. coli bacteria to produce a drug that you want, and you have room for lots of errors because you can kill off the bad cells, and you're okay if only 1% of cells actually get the edits that you want, awesome. But if you want to change things in a human being, it's very tricky. And there's technologies where we can take an embryo that's just 8 cells and edit the genes in that. That's relatively easier, but we seldom catch an embryo at the 8-cell stage unless you have in vitro fertilization or some other assistance in getting pregnant. But if we want to edit you, TA, you've got, more than several trillion human cells in your body. So more important than CRISPR, which is the editing tool, is how do we actually deliver the CRISPR payload or some other payload to all of those cells in your body? And it's an incredibly, incredibly daunting challenge, and we're not there yet. The traditional tool to use in humans is a virus, because what viruses are delivery mechanisms for genes. And a virus, if you get infected with a cold virus, the virus comes in with a payload of additional genetic code that it delivers to certain cells in your body. And usually that genetic code is instructions for making more copies of the virus, right? That's what it is. But we can hollow out the virus, take its machinery for infecting cells, and put in a new payload that says, add this gene to fix this hereditary disease, or add this gene to make more of this muscle-building growth factor, so you'll be stronger, and so on. So that's been the traditional route that we've taken. But of course, your body has all sorts of machinery to fight viruses, and that battle between your immune system and the virus can itself be lethal. There have been multiple fatalities in gene editing as a result. So we're getting better, but we're still not really there.
Where have people taken it too far, ending up in catastrophic situations?
Yeah, so there's a reason we have an FDA, right? And I think the FDA might move too slow in approving stuff, but if they say something is dangerous, maybe you can get away with some of it, or if something has not been approved yet, maybe it's going to be just fine. But people have died. People have died by doing stuff to themselves off-label. People have died taking part in trials for new technologies. So a classic case is we had all these cyclists, professional cyclists, Tour de France cyclists, who started dying of heart attacks back in the 90s. And it turns out they were taking this hormone, EPO or EPO, that exists in all humans. That is a hormone that's secreted when your blood oxygen gets too low. You've been working out really hard. Your body creates this stuff called EPO. It's a messenger. It sends a message to your bone marrow to make more red blood cells. Because clearly you're spending time on the savannah and you've been chasing some woolly mammoths or been chased by tigers, and you must need more red blood cells so you can go faster next time. And so if you're a professional cyclist and you're at the top of your game, and 0.1% change in your speed is the difference between coming in fourth and coming in first, a little more red blood cells, a few more red blood cells, means your body can carry more oxygen and you can cycle harder and faster. So a little shot of EPO can make more red blood cells for you. And so you take this shot every, 3 times a week or daily, and then your red blood cells go up and then your blood gets thicker. So we had cyclists keeling over dead of heart attacks because they had taken enough EPO that their blood had just become too thick for their heart to pump. And so that's the risk. If you are going to do something that is not medically recommended to try to augment yourself, I'm not saying don't do it. I do things that are off-label. I'm not going to talk about all of them. But I'm just saying that there's a reason these things are off-label. Similarly, in the development of the technology, in the origin of gene therapy, of delivering genes to already, living kids or adults, the immune system doesn't like viruses and it fights it. So we had this classic case. Gene therapy looked so promising in the 80s and 90s. And we had this kid, Jesse Gelsinger, who died. And he died not because of the new genes that were delivered. He died because his body fought the virus that was trying to get the genes to save his life into his cells. It fought that virus hard enough that he just went into a downward spiral and keeled over dead. And then years later, gene therapy, all work stopped for a while. We had another round of gene therapy start with new attention to safety on that issue. And then we found in some other patients that the gene therapy techniques were delivering the genes to the wrong place and were breaking up. They were delivering them into the middle of existing genes that already worked, that were anti-cancer genes. And by so doing, we started giving some people we were trying to save cancer by breaking other stuff in their genome. So then all gene therapy work stopped again. So we're getting past those problems, but people have died either from being amateur self-hackers or from just bravely taking part in these trials. So this is not for the faint of heart. And I'd say just read up. If you want to try something new, go Google blah, 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 dangers. Go Google blah, 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 risks. And just find out what the possible outcomes are and then ask yourself, is the benefit worth it to you for the potential risks?
Yeah, it's interesting that there's a couple of therapies that I know of friends that are having them that it is highly predicted they will end up with a blood cancer that will ultimately kill them. But the gene therapy dealing with their particular condition is better to extend life, knowing that that's likely to happen or is a reasonably high likelihood of happening.
Yeah, and gene therapy is getting better. Like we just had in the last 12 months, we've had the first 2 gene therapies ever approved for clinical use, 2 in the US, 1 in Europe. So like we've hit a new milestone. But there's still dangers. And now stem cells. People are really excited about stem cells, right? I'm going to get a stem cell. I've got a bad ankle. I'd love to get a stem cell injection to deliver some new cells to grow more cartilage in that ankle. Awesome. And so we talked about medical tourism in Thailand. People have been going to Thailand or Costa Rica, getting stem cell injections. Those would be miraculous stuff that has not been approved by the FDA. And so we had a case of this woman, got a stem cell injection in her eye to try to restore some issues there. And her eye started growing strange tissue. It started growing tooth enamel tissue inside her eye at the site of the injection. So if something looks miraculous and has not been approved, the vast majority of things that go into FDA approval fail. They get rejected. A lot of them fail because they actually end up not being effective, even though everything tells us it looks like it should be. It works in animals. A lot of them fail because it doesn't work in humans. And then others fail because it does work in humans, but the side effect it causes is actually worse than the promise of what it's doing. So I don't want to be a pessimist. Like, I believe that we are a remarkably ingenious species. I believe that we will keep overcoming diseases. I believe that we'll eventually extend the human lifespan beyond 120 years, though we're nowhere close to doing that today. And there's nothing on the horizon that I see that'll do that right now. But we'll eventually get there. But we are just friggin' complicated. And spaghetti code of the genome means that nothing you do happens without side effects. So just be careful.
And where do you think that from a performance or longevity perspective, where do you think this type of technology will be applied?
Well, I think what we're going to see is any of these human augmentation technologies are first going to be applied in a healthcare setting to help somebody that has hereditary disease, or help somebody that has an injury. Maybe it's a brain injury in the case of the brain tech, or some other problem that's gone on, to deliver genes or circuits or whatever to cure that problem. And then we're going to find that the same technologies we've developed for that also have a potential benefit to healthy people and augment them. I'll give you an example. One of the types of gene therapy I wrote about in More Than Human is for muscular dystrophy. So it's there's actually 4 or 5 different genes we know of that are being trialed for people with muscular dystrophy, where their muscles waste away, that can help rebuild. They tell the cells in the affected muscles to build more healthy muscle fiber. Awesome. Potentially very useful for that. And for other diseases, we lose muscle as we age. For instance, it could help people be less frail and more healthy. But it also turns out if you take a healthy young animal, you take a baboon or another primate that's healthy and has no disease, and you use this technology, you can make it super strong. Now, I'm not talking about like X-Men level super strong, but I'm talking about 50% stronger with no exercise than a human, or than a normal member of its species would be. So, of course, you're going to have people, whether they're professional athletes or amateur athletes, or just want to look, more buff, or want more muscle that will increase their resting metabolism and burn more fat and be skinnier. Of course, you're going to have people seeking out this technology. In More Than Human, I quoted one of the primary scientists at the time working on this, who said that more than half the emails he got about his work were from athletes or coaches or people involved in professional sports asking if there was some way they could get access to this technology. So you can see the interest.
Yeah, and it's been used and abused in many different categories.
Yeah, and
human growth hormone, EPO, others are just prime examples of that.
That's right. So in the 80s or 90s, we had this scandal in cycling with EPO. EPO is a hormone that your body creates to tell the body to create more red blood cells, but you can get it synthetically. So cyclists were shooting up EPO to have more red blood cells and thus have more endurance. Well, we have done in animals EPO gene therapy, where with a single shot, we can, for life, give an animal higher levels of EPO and thus higher red blood cell levels instead of having to take an injection every day. So, and it's almost impossible to detect. So we've caught people doping with EPO. The fact that they have to take an injection every day makes them easier to catch. We don't really have any technologies to catch people doing gene therapy to augment their performance. So it's totally possible that this is being used in sports already today and has been for a decade, and we just don't know.
Where do you think the most human experimentation is happening on the planet? So if you think about these kinds of things, let's say from a performance perspective, what's your hypothesis on where this is happening? Obviously, sort of in the 80s, there were certain places. Yeah. 90s, there were different places.
I mean, it's very likely it's happening primarily in Asia. For a few reasons. One is you look at attitudes towards genetic enhancement, and people in the West tend to be much more morally skittish about it than people in Asian cultures, for whatever reason. Two, you have places like Thailand that already have a huge medical tourism industry. So you can go to Thailand and get a cosmetic surgery or a sex reassignment surgery or all sorts of things for much cheaper than you could in the U.S., and you see people that are doing sort of interesting stem cell therapeutics that are probably pretty risky and too dangerous, and they're often in Costa Rica or Thailand or something like that. And then three, China has become really a powerhouse of biotech research. So a lot of the work happening in gene therapy and genetic editing for human health, for instance, to fix problems in an embryo that's going to become a person that has a hereditary disease, the most impressive papers are coming out of China consistently. So I don't know if the augmentation is happening in China sort of undercovers. It's sort of a hard place to operate in some ways, but it wouldn't shock me. And I do think that in places like Thailand and Southeast Asia, there's probably places you can go today to get some experimental gene therapies that you'd have a hard time finding in the U.S.
Yeah, we have a project here at Pioneer Square Labs, which we're looking at the whole IVF space for a variety of reasons, and it's fascinating to what is possible from a testing, a segmentation, a thought processes, what is most likely to result in a live human birth or a live healthy human birth, and what can you know at the egg stage, at the embryo stage, genetically or visually even, and we've been spending a lot of time looking at that overall space.
Yeah, and so it is still challenging. I mean, about 1% of all babies born in the U.S. are conceived via in vitro fertilization, IVF, which we used to call test tube babies, and now we just say, oh, we had trouble getting pregnant, went to a doctor. But for the easiest gene editing, you've got to catch the embryo at that early stage, and that's still a process that costs tens of thousands of dollars, involves usually several rounds, dozens of injections. So we're still a ways from that becoming super mainstream, I think. But 1% of all babies born in the U.S., 4% of babies born in Scandinavia, that's not a trivial number.
When, as a science fiction writer or a near science fiction writer, like, when do you think it trips over to where people choose that as their means of having babies, primarily because you'll be able to sort of make these gene edits along the way?
I think it's a long way from that being the norm or being the most common thing people do. But I think, if you are a couple and know that you are carriers of some hereditary disease, maybe you both are, maybe you're in a certain subpopulation, Ashkenazis, Jews, that have a high incidence of certain diseases, for instance, or you just happen to both come from a place where you're both carriers of something, yeah, maybe you're interested. In the U.S., you have to pay for it out of pocket. In places like Sweden, it is actually covered under their national healthcare systems. So then you figure out, are you willing to handle the discomfort, mostly for the mother, of usually several months of many injections to overproduce eggs and egg extraction? Are you willing to do that? People are pretty motivated to have kids, the ones that want to. So some will. It'll still, I think we're decades and decades away from it being the most common way people have kids. But I think we'll see it in those particular cases get more and more common.
And given that the subject of our podcast is around longevity, and you are seeing both mothers becoming older, for the first time ever, there are more women over 30 having babies than under 30, at least in the U.S. And I can certainly imagine sort of the second family, the third family, type of situation, primarily from eggs which may have been harvested when somebody was 25.
Yeah, I think we're getting there. I think it's easy to get excited about egg freezing and not realize how early it is. I think there's been, well under 1,000 and maybe less than 100 children born from frozen eggs. Frozen embryos are easier than frozen eggs in a lot of ways, but of course you have to know who the other parent is going to be at that point if you want that. But yeah, I think it is plausible. We have some developments just in the last 6 months on artificial wombs that could carry a pig anyway, outside of the body. So I think we will start to see more of that. But bear in mind, egg freezing today, it's just like IVF. You get the mother or the mother-to-be gets dozens of injections, painful, huge hormonal shifts and mood shifts. The pain of egg extraction is massive. The process costs about $30,000 today for egg extraction. It costs several $1,000s per month to keep those eggs frozen, and then it'll cost another $20,000 to implant them. So this is not for the faint of heart. And while the sci-fi is there, or the sci-fi scenario is there, this is not going to be something that is mainstream tomorrow. We're still talking decades, I think.
Tell me about changing subjects a bit. Tell me about your journey to Singularity University.
Yeah.
And maybe you start with what is Singularity and how did you end up being affiliated with them?
Yeah, so Singularity University is neither about the singularity nor is it a university. Where I start.
Aptly named.
We're a think tank, and we do education for executives and business people and government people on exponential technologies. So what's an exponential technology? Any technology where there's a consistent doubling of price performance that we can quantify. So the obvious one is tech, Moore's law. We double the price performance roughly every 18 months of computing and of bandwidth and of memory. And it turns out 3D printers have a similar thing. Solar power has a similar thing. Batteries have a similar thing. Not all at the same pace. The doubling of price performance of solar is more like every 5-7 years, not every 18 months. But still, we can see that it's exponential, that it goes at this pace where usually in the short term, you're disappointed with how fast the change is, but over the long term, the change is really profound. So we do a lot of programs, anything from, we had our 3-day global summit in San Francisco 2 weeks ago, where we had a couple thousand people, to we do executive programs 10 times a year on our campus at NASA research campus, basically across the street from Google in Mountain View. We'll have 100 people from different companies come for a week, and we give them, talks and perspective on robotics, AI, machine learning, digital healthcare. I'm the energy guy, biotech, CRISPR, all of that stuff, and it's amazing. It's great fun.
What are some of the things that you're seeing at Singularity? I know that it's Daniel Kraft. Is Daniel still involved?
Yeah, Daniel is our chair for health. He's an amazing fellow.
And so with yourself or Daniel, what are some of those things that you're seeing that via the lens of Singularity from a health perspective?
Yeah, I mean, I think with health, the stuff that is going to impact most people in the short term, I think, is the intersection of digital tech and health. Everything in quantified self, in taking sensors and diagnostics that used to be multi-$1,000 devices and shrinking them to be peripherals for your cell phone, in wearables that track our health for long periods of time, in the generation of big data that we can mine from that to learn more things about patterns of people, in the digitization of healthcare information and democratization of that into AI systems that can do diagnostics or even give advice for consumers based on what they're seeing. I think there is a big regulatory hurdle for a lot of that stuff, so we might see a lot of it appear first in developing world nations where there's less regulatory constraints, and then get re-imported back into the U.S.
Yeah, as you we talked about before, I was involved with a company called Synosis, and Synosis was a spin out of UW, where we were using just the sensors on the phone to do clinical diagnostics, everything from cough signatures to hemoglobin to bilirubin in babies with jaundice. So familiar with the concept of the phone becomes the center, and in that case there were no peripherals involved, but also interesting to see like a local company called Steth.io, which has made a phone into a stethoscope as just a peripheral device, and it's not even an electronic device, it's just a diaphragm really, and now being able to upload heart sounds to the cloud, being able to diagnose all different kinds of heart issues in an 100% remote way, in a way that people can track over time.
Yeah, I think that's absolutely a great set of examples of what's happening there. And also, I mean, doctors are skilled practitioners at taking diagnostic information about a patient and this huge amount of data they memorized in med school and their residency and coming to conclusions, right? But it turns out we have other technologies like machine learning and big data that are really good at that. So there's some companies around, I'm not sure exactly what I can say, there's some companies in stealth that are really looking at using machine learning, natural language processing, chatbots, where you can talk to something and it comes to a pretty good judgment of what your situation is. Now, the FDA won't let an AI make a diagnostic judgment or write your prescription, but it can then bump it up to a doctor and say, here's the data I collected, here's the conclusion I came to, what do you think? And the doctor can say, oh, I think that's right, let's prescribe this, or let's hit the button and make it far more scalable and lower cost and far more convenient for you than having to make an appointment for 3 days hence to go into a doctor's office.
That'd be somebody like in Seattle, like 98.6.
Well, 98.6 is who I was not sure to name, so it sounds like you can never remember what's exactly public or
who
not
told
public.
me what and what I could or I couldn't say. But
it's the problem with having too many friends.
I'm pretty sure they're clear about that part of it. Maybe not the exact detail, but I think Robbie and his team are pretty clear about, at least externally, about what they are working on or what they're working toward.
Yeah, so I think that's one of the coolest startups in digital health, and it happens to be here in Seattle.
Yeah, exactly. And let's transition into the billions. So all the people who do have a smartphone in their pocket, and how we can transition healthcare and really longevity to sort of developing world. What are you seeing there?
Yeah, so I'm an optimist about tech and its impact on equality and poverty. And I wrote about that in More Than Human. I wrote about that in Nexus indirectly, which is we used to have this notion. Remember, we had this notion of the digital divide? Like in the 80s and the 90s, Time magazine covers of how digital tech was going to be only in the hands of the rich, and it was going to cause a runaway inequality because you'd be able, if you were wealthy, to use digital tech to augment yourself in various ways, just get a better job or so on, and poor people wouldn't. But it turns out that while, of course, digital tech has created some massive winners, especially those that produce the tech and latch into network effects and high scalability and can create billions of dollars in wealth for themselves, that it's produced probably trillions of dollars of value that we don't capture in any good metrics by just lowering the cost of communication, of access to information, of access to markets and services for billions of people around the world. So an example is in talks sometimes is you remember the film Wall Street? Right? So that the villain, the guy you love to hate, is Gordon Gekko. And they filmed a scene to show how wealthy he was, where Gordon Gekko is talking on his mobile phone. And his mobile phone is the size of a brick. Like, it really is. It's slightly bigger than a brick. It's this big gray monstrosity. It's like, he has to like reach his hand all the way around it. It's like, 12 inches long and a few inches thick. That's a Motorola Dynatac.
Yeah,
it's a real phone.
Had one.
Yeah,
had
man.
One.
Oh, you must have been a wealthy billionaire.
Had the car phone in the back, too. That had the big pack in the back that was the size of a backpack with the wire coming all the way through the car.
That's right. So that Dynatac it's about $10,000 in today's money. It took 12 hours to charge fully. It had a standby time, not a talk time, a standby time of 30 minutes. It had no camera. It had no apps. It had really, really terrible reception because there were no cell towers. And now, in Kenya, you can buy an Android smartphone for $20 and you can get 3G service across a lot of Kenya. Kenya has, 94% cell phone penetration among adults. That's mostly feature phones, but smartphones are growing. India, by the end of this year, we think there'll be 500 million smartphones in India. That's, 1.5 times the population of the US. So at SU, at Singularity, we talk about stages of what happens when you digitize something. And one of them is demonetization. Things that used to be expensive get really cheap. And the next is democratization. Because things have gotten cheap, people just go wild. Access to it goes wild. So that will happen for any digital tech in healthcare as well. When we digitize a doctor, when you digitize a diagnostic technology, when your phone the example you were giving, can listen to your cough and give you good metrics about it, or when you can use your phone camera to peer into your child's inner ear or peer into your retina and get good information about, oh, wow, do you have a concussion or not, or does your kid have an infection or not, that is going to cost pennies, or it's going to be free. Ultimately. And that used to be a doctor's visit. And something in Liberia, where we had the Ebola outbreak a few years ago, there's 1 MD per million people. Right? There's a lot of nurses and other healthcare practitioners. But guess what? Liberia, one of the poorest places on earth, within a decade, and probably less than that, everyone will have a smartphone. And that's friggin' amazing. In my mind, that is, in my mind, the most important thing happening on Earth today in the long run. So not all parts of healthcare will be digitized, or some will take longer than others. But for a lot of diagnostic stuff, for a lot of access to healthcare information stuff, for a lot of personal advice on how to run your life, for a lot of sensor stuff, it will get digitized and it will get democratized, and it will have a massive benefit to people in the poorest parts of the world.
Yeah, I think that it's tremendously exciting, and in some cases where they have the least amount of resources, they'll make the fastest progress.
Yeah, that's right.
To the place where information and personalized information or personalized information delivery becomes the critical piece, into a place where they don't have access to clinical professionals. And that's exciting.
Absolutely.
And it'll flatten that curve of people being able to live longer, being able to live better, with the concept of healthy life years.
Absolutely.
I'm interested in your thoughts around brain enhancement, both in terms of the physical brain enhancement as well as chemical brain enhancement.
Yes, there's a lot happening. I'll say there's a range from the prosaic that you can do today to the sci-fi that might become real. For what you can do today, it's very similar to the list I gave on other health things, which is cardio exercise, sleep enough, and challenge yourself with new thoughts, new learnings, and so on. And then, the next step, the chemicals you can take to augment your brain performance, well, you might take some already. Caffeine is a stimulant that augments your performance. Nicotine, though we, hate its impact on lung cancer associated with tar and so on, we know that various forms of nicotine are stimulants that enhance performance. ADHD drugs, the Ritalins, Adderalls of the world, it varies. That does vary from person to person based on their genetics of what the optimal level is. And for some people, any addition of that sort of thing is actually a detriment. But for most people, a little bit of such a compound or of a modafinil, a Provigil, probably increases performance, increases the ability to learn things and so on. And then further down the pipe, we do see the potential of gene therapies, of new sorts of smart drugs to lower the threshold for learning, to improve focus, but just aren't here yet. And at the ultimate, I think, are these brain-computer interfaces, these ideas of direct modification or interface with the brain, either outside of the brain, through the skull, or with implants. And some of the things that are happening there might not be that far away. So at the far end, we have putting chips inside the brain. We've seen amazing stuff happen as far as data input and so on. But the nearer end, there are technologies like transcranial direct current stimulation, where we run a low-level current over the skull, and it seems to lower the threshold for learning. It seems to potentiate the neurons in your brain. You learn through something called long-term potentiation, where two neurons that fire together, the synapse that connects them, that makes that circuit, gets tighter if they fire in conjunction. And transcranial direct current stimulation, or TDCS, so far as we can tell, looks like it lowers the threshold for new memories or new synapses to be formed, or those synapses to become stronger. And there are consumer kits on the market that you can potentially employ, though data is mixed as far as whether or not it works. There are companies that have TDCS products you can buy, some of them for sports training. I've heard of companies that are talking about putting out TDCS kits where you could use them while learning a new language or learning to play the piano that would potentially speed that up. So I'd say the data is still a little murky on that. It might be that positioning has to be exactly right or that different people respond. But I think in the next 2 to 4 years, I think you're going to see more stuff coming out that's non-invasive, where we don't need surgery, and it potentially really augments the brain. And TDCS is one of those. And there's some other stuff with transcranial magnetic stimulation, with ultrasound stimulation that I think is, realistic in the next decade, certainly, to have these wearable devices that go around the head that might actually speed up our learning.
Have you tried any of them yourself?
I have tried them. It's just really hard to tell if you've seen any gain or not. These are the sorts of things where in a randomized controlled study, you see that one group learned 27% faster than the other. So you don't know. If you just put it on and you did some archery or whatever, you don't really know if you got any better yourself. You have to measure it across a large population or have it for weeks or months before you can really tell if you've made gains.
You mentioned that you learn about a lot of stuff on Twitter or following other people. Who are some of the people you'd recommend our guests follow, social media or otherwise, to learn about this sort of near-term sort of stuff?
I think that there's some good media outlets that will give you articles about some of this stuff. I think MIT Technology Review, I think New Scientist, I think those are a couple sort of pop science-y outlets that give you a wide variety of information in a form you can digest. I think there are some people that are really into performance enhancement that have wide followings, like Tim Ferriss is one. Obviously, I don't think Tim is right about everything. I think sometimes he gets the science wrong, but he's more right than wrong, and he will at least give you pointers, interesting stuff that's happening. I think there are some other outlets that are really good. There's Neurohack's Twitter account. There are science journalists like Ed Yong who are really good on this. So those are some places you could start. And
I find the Singularity work is very good.
Yeah,
the summary that Daniel and team put together, I find is very, very good and informative.
I think that's totally right. Thank you for saying that, TA. So you can follow Singularity Hub is our site where we post articles, and you can go to the Singularity Summits YouTube account, and you can find videos there on all sorts of topics from our summits, and you can find videos from people like Daniel Kraft or Divya Chandler, who is our chair of neuroscience, or Tiffany Vora, who's also on our medicine faculty, videos of talks they've done that will give you a wide overview of a variety of stuff happening in digital healthcare, next generation health. Raymond McCauley, another one of our faculty, on gene editing and genomics, that'll give you a broad overview of cool stuff that's happening.
And if we want to go one level further and start reading sci-fi,
yeah,
that is a couple of standard deviations out, what do you recommend that people read other than your own books? Please list them before we go on.
So my novels are fun. They're sort of, someone's described them as Tom Clancy meets Burning Man. So the Nexus is the first book, and its sequels are Crux and Apex, and they're really about the impact of brain-to-brain communication, but they get into a lot of other performance enhancement. Other authors who I think are really interesting in sort of a relatively near future way, Charles Stross is a British author who's written some amazing stuff. Ken MacLeod, Macleod, is another Scottish sci-fi author who's written a lot of interesting stuff about biotech and human enhancement. William Hertling has written more about AI, but some super fun near future sci-fi. He's a software engineer who lives in Portland. So those are some places that might be fun to start. Paolo Bacigalupi writes more dystopian sci-fi.
That's a good name.
Paolo's amazing. He's won every award in sci-fi. He's an amazing author. He's much more of a pessimist, so he writes about the negative scenarios, but he's got an amazing creativity and is just a brilliant, brilliant author.
Yeah, or Cory Doctorow is another one that I like a lot, and our very own Seattle-based Neil Stephenson.
Yeah, how could I forget Cory and Neil? Cory Doctorow has been a huge inspiration to me, and also he's a freedom fighter. Like, sort of, I think of myself in the same way. He's writing about not just technology, but about the freedom to use it and the democratization of it, rather than the locking up and control of it. And then Neil Stephenson is a master of the craft here in Seattle.
How has all of this changed your own personal routines? What did you believe 5 years ago? What do you believe today? And your own personal routines on both performance as well as longevity.
So I wrote More Than Human in 2003 mostly, and I thought that by now we would have very common gene therapy being used for medicine. We'd have probably some black market enhancements happening. I thought we'd have
I think we do have
probably. I thought we'd have a lot more. I thought we'd have pills to slow down the aging process. All of that has gone a lot slower than I thought. So I'm more aware that the human body and the human genome being spaghetti code and our low tolerance for error. We don't say move fast and break things. In healthcare, we don't say fail fast.
We do on this podcast. Move fast and break things.
Don't
you might step a little sideways and say, that wasn't such a good idea. I think they do that at Burning Man, too. I think there's a little bit of move fast and break things at Burning Man.
It's true. You don't see it in a lot of like FDA new drug approval documents.
They're the move slow and don't break anything and don't take any risk.
That's right.
Which is on the other end of the spectrum. And I think a lot of the people that listen to this podcast and your expertise are thinking about what are the things that have modest to low level of risk that could have modest to high level of benefit. And yet that may be years or many years ahead of what we'll go through an FDA process for a variety of reasons.
That's right.
And so that's why I'm interested in the things you've learned and attempted on your own.
So when I've looked at the data, I try to go back to primary data and try to quantify things. I have found that the things that are most well-documented, not just well-documented, the things that are the largest effect size for performance and longevity are really prosaic things that have massive impact. And they are cardio exercise, especially high intensity. It doesn't matter how long it is, just do it often at high intensity. Like 3 minutes. I do a 3-minute run a couple times a week, 3 times a week. That is like the highest ROI thing you can do. 2, get some sleep. 3, eat moderately. Like I eat a high protein diet, but like keep your calories relatively in check. Probably avoid a lot of refined sugar. 4, challenge yourself mentally. Learn new things. Do things that are fun. Travel, read, engage in whatever it is that's a new mental challenge for you. Those things have effect sizes that dwarf the potential effect sizes of any nootropic that I'm aware of. And even, they're similar to the most incredible things we've done in animals. Not quite that far. Okay, in animals we've done more crazy stuff than that with gene therapy, but these things are not that far off, and I think that we underinvest in them.
Let's expand on 3-minute exercise. What does that look like? Why did you come up with 3 minutes? Who told you about it? Expand on 3-minute exercise.
Yeah, so I got really interested in the idea of high-intensity intervals just because I saw articles about it. There's a great reporter at the New York Times named Gretchen Reynolds, and she writes a lot about high intensity, and they just found some shocking stuff. So one classic study, by classic I mean about 5 years old, is they compared two sets of people, a randomized controlled study, golden standard. They put one set of people on a program where 3 times a week they would exercise for 90 to 120 minutes at moderate intensity. The other group was assigned a program where 3 times a week they would do a 30-second sprint and then cool down for 4 minutes and repeat that 4 times. The group that was doing the 30-second sprints, 4 of them per day, gained as much fitness in like 10 different measures, whatever, like various measures of how fast they were, how much improvement they got to their pulse, how much improvement they got to their insulin resistance. They gained as much as the group that was doing 90 to 120 minutes. Other studies have then taken that and shortened it. We found that 2 30-second sprints can do it the same. We found that a single all-out run as fast as you can go for 2 minutes does about the same. And it's too soon to have longevity data about this, but all the other markers of fitness that you gain, improvement to your insulin levels and your insulin resistance and your blood sugar look so promising that my bet is that in addition to it boosting performance, boosting mental clarity, boosting mood, boosting attention and focus, making you feel better, that it probably also has the same longevity and long-term health and disease resistance effects of long cardio exercise. And I'll tell you one last thing. The thing that surprised me is I started doing this because I thought, okay, this is the way to get the most fitness. But I learned that by shrinking my run to 3 minutes, I've never been a runner. I freaking hate running. Let me just be honest about that. I hate running, right? But by making my run 3 minutes, I just did it more often because, I work from home when I'm in town. I travel a lot, or I travel and I stay in hotels. And I would think, I've got a meeting in 30 minutes. I've got to get, a phone call or a video meeting, whatever. And it used to be to get to the gym and back and just like leave the parking garage and so on. That was a 30-minute overhead. So I'm not going to go to the gym. I used to go to Gold's on Broadway. I'm not going to go to the gym if I have 30 minutes. There's just no time. But guess what? I can put on shorts and my running shoes, do a 0.4-mile run around my neighborhood. Takes me about 3 minutes. I come back feeling like I'm dead. That's how I know that it's success. I'll give you a sound effect. Here's what I sound like when I come back. Like I feel like I'm going to die.
Good levels on that. Good levels.
Sorry for the editing work on that. Then that's success. But it's so short that I have no excuse not to. And I don't really feel the pain of it until it's over, to be totally honest. So that lowering that activation energy also has a huge, massive positive effect for me.
And how about frequency? So the 3-minute high intensity frequency.
3 times a week. For cardio gain, there's some data showing that more often than not, you just don't really get a whole lot more gains, but every other day.
Do any strength training?
I do strength training. I put in a little micro gym in my house. I have a guest bedroom. The guest bedroom has a pull-up bar in the doorway. I've got a bench inside, and I've got a cool set of dumbbells where you can turn a dial. Like they sit in a cradle. You can turn a dial, and it changes how much weight you pull up. And that's basically all of my gear. And again, intensity and frequency trump volume. You don't have to do 3 sets and spend an hour. I literally, if I walk by the pull-up bar, I try to do some pull-ups. I couldn't do any pull-ups at all a few years ago. Now I can do like 10 on a really, that's my record is 9 3/4. And some days I can only do 4, but that's fine. Or I'll go in and I'll do a quick set of curls or bench. And if I have 5 minutes, I can do an exercise. And that's all you need is 1 to failure. Of course, more is better. Like we can see that clearly. If you do 3 sets, you get more gains. But what actually matters is doing it with high intensity, doing it to failure, and doing it 2 or 3 times a week.
What would be the one thing you mentioned that you do a few things that are off-label? What would be something you'd recommend, given your own personal experience, that someone else experiment with?
Yeah, I mean, I think there's a variety of sort of mild nootropics that are prescribed for certain cases. So a classic one is modafinil, which is the generic name for Provigil, and that's prescribed for narcolepsy. That's prescribed for shift worker syndrome, but it's not uncommon for people to use it off-label to get a little bit of focus. It has a better ratio of focus gained to jitters caused than caffeine. So especially if you travel and you're in a new time zone, and you have to get up in the morning, that's not a crazy thing to try to even get from your physician or get in some other mechanism, and try at a low dose, for instance.
As you look toward the near future, next 1 to 3 years, what technologies are you most excited about relating to health and longevity?
For me, I think the biggest impact was trying to stay on my routine. But I am, as a consumer, I'm very excited about not having to go to the doctor. And I'm excited about getting on my phone and texting with a bot and saying, I have these symptoms and I have a digitally connected thermometer and it can see my fever. And then an Amazon drone drops off my prescription 15 minutes later. That's what would make my life a little bit easier.
Thanks a lot for being on the show today, Mez.
Thanks, TA. Super fun.
You've been listening to another episode of How to Live to 200. Thank you so much for joining me and exploring this world together. I get a ton of help from the L200 crew that includes Lauren Krayinsky and Kevin Kirkpatrick. The theme music is composed by Emmett McCann. Yes, that's my nephew. You can learn more about this and other episodes at our website, livingto200.com, or find us on Twitter or Instagram at howtolivето200, where we post lots of photos of cool things. It's early days for this podcast, so we would appreciate any and all comments or telling a friend or two about what we're doing over here. It might be irresponsible for you to keep it a secret. Until next time, eat right, get lots of sleep, keep good numbers, and be looking around the corner for the next big breakthrough. If we're going to live a long time, we better do it well.